I've talked to people who were waiting for a knee operation, so they had one bad knee, but because they had to wait for a couple of years, by the time they got there, the good knee, because of the extra stress it was going through, carrying the weight of the bad knee, this knee was also now breaking down as a direct result of the weight.
Today, SecondStreet.org is going to sit down with Janet Walker, who is a former nurse and healthcare educator who has done a lot of research into how Canadians are impacted by long waiting lists.
Well, in preparing to carry out my research, I did a literature review, and I found that no one had done this research before. No one had actually asked Canadians, patients, what they were experiencing. I guess the picture I found was a picture of profound suffering, and it was much worse than I thought. Another woman, a young woman with a very young family, she said, look, I used to have a house, a job, I had four-course meals every day, I managed my own garden. She said, now I'm lucky if I can get pancakes on the table for dinner, because she is still dealing with the pain. And even worse, she was being treated as a drug seeker. She told me that now I'm addicted to Tylenol number 3, which is a narcotic. And she said, I told my mother I wouldn't do anything, and I hope I can keep that promise. Of the 50 people, most of them went to the US, but a significant chunk went to India, and some of them, about 20%, were in Canada. They just found private clinics in Canada. And some of them went to India, as I said, and a smaller number of people went to Europe.